Because this is a relatively new initiative, I don't know how much insight, how much data, has been collected. I don't know if they really know the long-term effects of the Housing Champions program as of yet, but I do know New Hampshire Housing does have a list somewhere. New Hampshire Department of Business Economic Affairs has also done some work highlighting those communities. So I'll try to dig up that link quickly. But again, yeah, I think it was like 26 communities where um, identified as housing champions.
I think a number of those had some good results, but then our county had nothing has actually come to fruition yet. And so there's been some angst on it. I mean, as much on the outcomes of this as there are on how do we hold people accountable for EFAs, right? It's all kind of in the mix there. So
I think that helps understand the definition of a housing champion, because that's not my initial thought. So if this details goes forward beyond us or even with us, we may actually want to put a footnote in. I was thinking like a head is a housing champion. I wasn't thinking more of an official designation that has more heft and meaning to it. I just didn't know how to interpret that. So that's very helpful.
May I just make a comment?
Sure.
This is Polly. Thanks. We had a presentation, Commission on Aging had a presentation last week from New Hampshire Housing, and I'm not going to get the numbers right, but my understanding is that when they looked back, and it might have been in 2024, that those municipalities that had the housing champion designation had significantly more housing starts than those that did not have that designation. So there is data that New Hampshire Housing has, and I think from what I understand, the initial review was positive if the goal is to increase the number of housing starts.
Good.
Yeah, and I think this goes back to what Dee was just mentioning earlier, and Kathy, Kelly's here for Kathy today, but I think Kathy was mentioning a bigger issue, which the Ed and Polly and others have brought up for the council, is that we are over planned and not connected. So it's like, how is there maybe a role for this group as far as like people want more plans and they probably don't need plans, they just need more connection to the plans that we have.
And I think that's, I mean, for me, it's been challenging. I'll just give you a brief example that we at ACHS, Federally Qualified Health Center, have a strategic plan document. We do a regional community needs assessment, and we have a state health improvement plan. So I personally could take the time to look at all three of those plans and look for alignment. I did not do that per se. I did leverage AI. I do caution that it does hallucinate and it does need an adult chaperone. I did ask the question. I said, show me where the community needs assessment, the state health improvement plan align, and what are we doing in Ammonoosuc that's delivering on those areas of alignment? And it was really fast, and it gave me something to engage with without doing scut work, because it's mind-numbing to look at multiple documents and try to use a human brain to do this. You kind of have to evaluate because sometimes it makes shit up. So I did similar with this legislation. I was curious. I asked it. I said, well, here's the shit. Here's this list of legislation. Show me alignment. And it was like red light, yellow light, green light. This list of them support. This list don't support, and these are neutral. And that was a very helpful first pass. And then I was thinking about how do we relate to legislatures, and if David is a legislator, and say, I know that you wrote this bill. Are you aware? This is an awareness campaign. I'm not making any judgment. Are you aware of the state health improvement plan? Oh, let's have that conversation. And, our first analysis indicates that the state health improvement plan says this about food. I can't understand, playing a little Columbo. How do you help me understand how this aligns with supporting the bill? Because it actually doesn't appear to. So are you aware that it doesn't align? And how do we reconcile that? Because if we think about it, the state health assessment is voices of New Hampshire residents who are somebody's constituent that was rolled up and articulated in a state health improvement plan. This is the people's plan. You are the people's representative. I think the people would expect that your legislation would mirror supporting what they said was important. So that's kind of that thought experiment I had with myself about, how would we engage in like the Fiscal Policy Institute? I'm pointing to a discrepancy. I'm not making a
Right.
judgment.
And I think Tori has a kind of an interesting idea. I think we hope, so hold on to that
Cool.
thought, because it's
Okay.
good. No, I think, but you're setting us up perfectly.
But I like the way this is nice. I like what the subcommittees are doing substantive work, and we're all getting smarter and educated out of it.
Well, but I do think, I don't want to discard that idea and what you sent. Again, the use of Copilot and AI does take a lot of this work away. I think we're still trying to figure out, again, a bigger conversation later, what do we do with it?
Well, that for me was take that work away so the smart people in this room can ask the question
Yeah.
of, so what does it mean? And what do we do with it?
Yeah, I mean, me looking at 1,370.
Oh, it's mine.
So this is our community, folks. They've just had an opportunity to meet once. I think we're meeting on Monday, but I'm not entirely positive, but it's coming right up a second time. Andy's on that, Ed is on that, Shirley is on that, Tori and Tricia are on that, and I believe every one of them is here, which is pretty amazing. So, good job. So we've only had one discussion. In our particular area, there was a couple of things. There is a bill to talk about putting 100,000 towards a post-secondary education level grant for those with developmental disabilities. That factors in, that does align.
Yep.
The child care scholarship program, this particular bill would add 6,090 children to that program, which is pretty substantial.
Wow.
That is a $29 million price tag, but the cost per kid is about $4,770. And probably, again, a major component of what, childcare advocates want, but it's also in our show. So.
Yes.
Just a little minor stick a needle in your balloon type thing.
Oh, stop it.
We don't have any money.
Oh, yeah, no,
And,
no, I think that's why, and I will say, I appreciate all the work group members
I'm
outlining that this is a cost, which makes it hard to swallow.
so like, we passed bills, yesterday. I don't remember what the fate of 1791 was, but like, we pass them with great intentions and then they have to go to the
Yeah.
finance committee and they have to decide whether we have the money for this or not. And I already know from prior discussions that anything that has a price tag probably won't make it.
And those were discussions that we had.
And that's really tragic, and it's really tragic.
Those were discussion. I think for our first pass, that really was a major factor we wanted to talk about, but also just learning how to screen bills for like, does it align with the ship?
And I think we need to focus on policy, not on finance. And, and anyways, I'll just leave it at that.
So
because we have
can
more
we
to talk
pause
about
it
later.
6:45 for a moment and riff on David's economics? So when I think about $4,770 per child, I can frame it as a cost. By framing it that way, we only cut costs. In healthcare, I don't use the economic term cost by intent. I use the economic term called investment. And the reason I use investment is none of us probably go to any retirement people and say, I'd like to cut my investment. That is awkward language in that paradigm. But no one ever goes and says, I'd like to increase my cost. It's equally awkward. So if we would like to get these children cared for, by framing it as an investment, now I'm going to go over to the Fiscal Policy Institute and say, do me a favor, help me demonstrate what the return on the investment is. As a taxpayer, I don't want to incur cost on the bridges I drove down on I want to incur an investment because I want them to stay up when I drive over them. If maintaining the bridge is all cost, we will defer, and I will die over one of those bridges someday. Eventually, it's inevitable.
Well, I think there's again, we have a huge movement here, some of which in rural health transformation about workforce.
Right.
So if we're going to keep the workforce, then we also need to be able to have the people getting their children into jobs.
I just think investment is an ongoing dialogue.
It is.
We're all in agreement. Now we have to figure out the how. If we're not in agreement, then figuring out the how, we're not there yet. And I used to work with Neil Kirk as House Finance Chair, and we had an agreement. If you're gonna vote party line, I won't come testify, I won't like it, but I'll respect it. You gotta let me know before I hit the road, or I'll be pissed. I will always promise, I will always bring a fiscal note with a return on investment analysis, because you're the.
Well, you do bring up a good point, because that's one thing we haven't done yet, and that, and again, Jess Williams is like part of the law for SHIP says we make recommendations, but we also talk about costs.
And the Fiscal Policy Institute is wonderful because of the nonpartisan nature. They're exquisitely detailed and cited with foundational data that are irrefutable.
If I could just interject, because this issue came up with our county, and our county just unfunded a number, and Maggie's fairly,
We invested,
whatever you want to call it. Yeah, they basically just cut funding for, and some important organizations, and we tried to bring up at the committee meeting, the concept of budget negative, budget neutral, budget positive. In other words, it either loses money, doesn't have an effect, or is an investment and generates revenue. You know, we talked about multiplier effects and so on and so forth, and I could have been talking to the wall. And these are issues that I think that we need to educate over and over and over and over legislators about, is just because something costs you here, it's going to bring you this much in the end.
that's your.
And they don't think that way. And I guarantee the name that you mentioned doesn't necessarily think that way either. And
But they do in their personal life, because they all must have a
Right.
retirement plan. And that, I would start to speak to where they listen,
yep,
that's personal, and then extrapolate their general understanding to a concept that's more controversial.
I think we probably want to get to this.
Anyways, go ahead.
I mean, again, well, there's more of these conversations. Yeah, I just want to make sure, you know, we haven't hit our online folks very much, but any of the community work group folks that were part of those conversations, if they have anything they'd like to add.
I think today HHS Oversight Committee talked about I missed the beginning about, not about this bill specifically, but it was, they were getting a report about the childcare in the state and the waiting list, and whoever was presenting said there was no waiting list, but it kind of crept into something like what you're talking about now, because I think somebody on the committee said, well, you know, there is no money, and then there was a discussion around, but we need a workforce when the grant money goes into play, but we also need a workforce that we don't have. There aren't enough people to go into these childcare centers to do the job. So there was like this circular conversation going on. So it just would be of interest if somebody wanted to just go back and look at that on YouTube, because it ties into that.
And the lack of a wait list may be a false negative, because if you beat the people up enough, they stop calling.
Yep. Oh, no,
It's-
in the end, I think the final commentary was, it's complicated. Like, you can't just have this basic conversation about it.
I gotta remember that one.
Yeah,
Well, it's complicated.
that's, yeah.
It kind of gets me back to this whole concept of having plans. I've developed 3 fabulous plans that would have saved this planet from all sorts of problems, and they just get filed into a file cabinet and nothing happens. And I'm really pleased that you brought up all the individual community plans that people have developed, because to me, those are the most important plans.
Yep.
And we need to make them real. And I like what Ed talked about earlier. I'm not an AI person at all, believe me, but I you know, like the concept of using that to make sure where we are, where we're going, what we're doing. And
It's a tool.
And
It needs chaperone.
yeah, and I'm not the good chaperone.
Thanks, Ann, for that. Just want to make sure before we move on that there aren't any other community members that want to have a little say. Again, I will apologize for having to do their update, but we usually, our first conversation is just scratching the surface, and we talk a little bit about what we're there for, and I get to hear about things that they do in their day jobs, which I normally don't do. So I appreciate them letting me kind of throw some of this out there, and we'll have more when it comes to the next meeting.
Fill at 11.
Exactly. And this is just, the last one about community legislation was, this is recruitment and benefit grants, talking what Ann was just speaking to about, and this deals with higher wages, better, speaking of money we don't have, but there was talk of using TANF funds, and they're asking the feds to use TANF funds for this purpose. And Ann, you might know more about that, but I think they haven't been told whether they can or can't, so.
Yeah, I don't. That's kind of been left.
Yeah,
There's
so that
no
was,
answer.
this bill is like, if TANF doesn't come through, you'd need 15 million, which again, as Dave said, we don't have.
So I have a question actually, because like, I grew up in a steel town and most of the housing there was actually created by the steel company. Because if you're gonna open up a steel plant, you're gonna need to have employees, and it's to your benefit to actually create that. And I would think that, we had this huge, beautiful presentation on healthcare yesterday, like high-tech healthcare, bringing it in here. And it's like the issue of housing did actually come up in that discussion. And, we always look for public solutions, but there's also private solutions for these problems. I know people have talked about that, but I do think we need to include that in the
I would
discussion.
have to go look. I think it's Dover, and I could be wrong. And it is it's not a huge company. Housing was a problem. They said, to hell with it. They bought some property. They worked with the local government to get a zoning change. It was approved. And it's a beautiful, relatively small, aesthetically pleasing, high function homes. And they're builders, so they understood. They did a really nice job. So I think that's true. And if you go back to Thomas Plant, this is the Castle in the Clouds guy. He did that when he had a shoe factory. He had the largest shoe factory in the world at the time. So there is historical precedence. And if you drive through Lisbon down 302 and you look up to the left, there's a series of homes, and they all look the same because they were built by the company at the time. So there are some legacies left behind that have nice sustainability. These are probably, and you're right, a lot of post-World War II homes. The other thing to think about, if you were a child in the 70s, the average family of 4 homes under 1,000 square
It's so
feet.
different. It's so different.
And we need to rethink functionality versus a Vera Bradley handbag that nobody needs.
I go back to something that Dee mentioned earlier, though, I think, and you're talking about exactly the same thing. It's like, how do we kind of use local legislation and maybe not state legislation to better partner with those folks that are already
Public-private
Yeah.
partnership.
What I'm getting
That's
at,
what the money-
I'll be the best government solutions don't involve legislation at all. And that's why I think we get back to these plans. We develop plans. This is what I'm going to do. If we need legislation, great. But I mean, like I just put a bill in that, created a humongous amount of discussion. I knew from the minute I put it in, the bill wasn't going to pass.
Right.
But it achieved what it needed to achieve without any legislation. And that to me is the best solution. So.
And I think that, again, zoning is a form of, I guess, legislation is local, but it's
Yeah.
one of those things that, as Ed points
That's
out.
New Hampshire. New Hampshire is hyper-local. We take reticence when someone comes to our town and tries to tell us how to live our lives. We're going to push back hard. Northern Pass is an example of telling a foreign government to stay out of our backyard. And there's a ragtag group of people who are highly successful in pushing that out.
Doesn't take many, it just takes being loud. So I'm gonna move us on because I know we got much more to talk about later, but our health status and outcomes group, which just met. I was bugging many of them late last night for the last of the updates. I'm going to bring in, I'm sorry, I think you can see that. I'm going to bring in Morgan, just gonna talk about, because Morgan, remind me the organization that I always get wrong that you're with regarding immunizations.
The New Hampshire Vaccine Association.
Thank you. I don't know why that's so hard.
You're welcome.
That got me in trouble. That's my favorite organization.
There's too many organizations and councils and whatnot, and they're all, different conglomerates of letters to remember. But yeah, so one of the first topics that we discussed as a group was the handful of bills related to vaccines. Overall, I want to say Scott, there was like 1,300 bills that aligned or didn't align or was in the wheelhouse of the House Health Status and Outcomes group. There was a lot. So we ended up,
We had a lot. Yeah, we had a lot. Yeah.
yeah, we ended up kind of picking just some heavy hit topics and trying to bundle some all together. So there is, I think 7 here vaccine bills. They're all pretty bad, if I'm being honest. They all have the same theme of trying to get rid of child immunization requirements across a bunch of different categories. I'd say the worst one that was brought in was House Bill 1811 down at the bottom there. But the good news is that that was actually ITL'd in the House a couple days ago. That was the most extreme one that would repeal vaccine requirements all across the board, just no more vaccine requirements throughout. So that was nice that one got shut down pretty fast. It was the most extreme. But there's still some pretty concerning ones here, from anything from no more Hep B requirements. You don't need to have vaccine requirements to be in foster care. They wanted to limit the number of vaccine clinics at schools and make it harder for vaccine clinics to run in schools by making parents have to be there when the child gets the vaccine and whatnot. Just a lot of either removing altogether or creating hoops to jump through in hopes that people either stop vaccinating their children or yeah, it's crazy. And this isn't the first year some of these vaccine bills have circled. I remember last session, there was a bill actually to repeal the Vaccine Association.
Yep.
Yes.
Of course, we were watching closely there in my role there. There was a couple other ones along the same vein as this. So this topic is come up again, and I think it's going to keep coming up.
Thank God our parents were smarter. Half of us would be in iron lungs today.
Yeah,
For
I
whatever
think
it's
people
worth.
forget just how short ago that was.
Right, for whatever it's worth, these are all House bills. The House is totally,
Under control.
yeah, you said it, I wasn't, I shouldn't give a minute.
I can.
But, and the Vaccine Association bill was near and dear to my heart because it was
Yes.
one of the bills that got me kicked off of Health and Human Services for supporting, opposing that bill. But anyways, all these bills have to go to the Senate. And many of these bills did not make it to the Senate last time, and I really would be shocked if they did this time, and then they have to go past a governor too. So,
We also have a.
they make a statement that they made it through the House. It was totally on party lines, and they will likely not pass the Senate, but it's important to be vigilant about that. So I wouldn't take that for granted.
And I think one of the things that the group kicked around a little bit was, and this is for future discussion, but the closest thing we came to a strategy was expand access to prenatal postpartum. And there's also one that mentions community screenings, et cetera. I mean, the group may want to think about something more specific in the ship around vaccinations if it's going to be under attack like that every single year. And that's for the council obviously to decide. But it was something that this group brought up. I thought it was a really great point. So thank you very much, Morgan. That was perfect. There's a term,
Thanks,
there's a term you used there that I've already lost. I'll have to go back to the recording. Whatever it was perfect. All right, let's see here. Let me get this out of the way. Sorry,
Can I
next.
just ask a question?
Sure.
So, this was brought up at the last meeting about, including the elderly in our discussions and major policy areas. Are we kind of, as we go forward, are we just kind of, I don't want to use the word random because we're not doing this randomly, but like randomly picking up subject areas like housing and vaccination and maternal and child care? Because, I actually did 2 town halls with elderly folks in the last 2 weeks. And, I heard a lot about what they have to say, and needless to say, this is an elderly community we have here. Are we just focusing, do we have a focus? I guess that's my
Well, I
question.
think we're trying to focus right now. I mean, Tori was brilliant and got us back focusing on the ship that you all created.
Mhm.
But I think another focus for the work plan, for the work groups, excuse me, is where it's missing. And Polly's been very vocal, and she's right, that is missing in the ship. So I think as a little further down the line,
Right, that's what I was getting. I
I think
didn't,
this is where we start. But again, that's my bringing up for further down the line. I think
Yeah.
vaccination may be a pretty important.
and something to tie all these 4 groups together too, right?
Yes.
Yeah.
Right.
All right.
And so Maggie, I'm gonna give you the floor here because there's no way I'm talking about this over you. Hopefully you're still with us. I mean, on the call, but not with us.
I muted my microphone because I have a loud dog, but short of that, I did want to speak. So these are just a few. I would say that behavioral health looks at so much legislation. Like we looked at all the vaccine bills that were crazy and usually will write in opposition to all the ones that are crazy. And I can say crazy because I'm in mental health. So I would say in this instance, 1070 is a bill that we just are working on with Representative Mannion to change the language because we have some concerns about the burden it might place on ambulance companies. Not that it's not better to be transported when you're a psych patient in a medical emergency by an ambulance instead of the police, but there are some implications for the liability for the hospital on the receiving end. And there's great concern with when patients come in needing an involuntary evaluation that hospitals can't react fast enough and the patient can leave AMA and bad things can happen, right? So this legislation hopes to strengthen some probable cause language that might allow the hospital to keep the patient for up to 6 hours, which could be good. 6 hours isn't always enough in an emergency room, but it's a step in the right direction. We opposed House Bill 1754 as community mental health centers because it takes away what had been working as a multi-tiered wraparound system for kids. And I don't know why somebody thought that was a good idea to legislate, but they did. And then 498, we supported that bill because it does help us to increase accessibility for kids to behavioral health services. You know, there's so many legislations, so many House bills out there right now with regard to insurance companies and parity for mental health services and will private insurance pay for medically necessary services that Medicaid pays for, but they seem to have a choice of not paying for. So we are in constant contact with the Department of Insurance as well as some of the lobbyists for the for the plans like Anthem and Harvard Pilgrim, and it's an uphill battle, but we're fighting it. I would say one of the things that we testified this week that I don't know if it's on there. 1794, did that get on there, Scott? I can't see the next page.
Let me see if I've got, no, it did not. Go ahead, please.
Okay, so 1794 is a bill that talks about the state having a responsibility to look at the big beautiful bill. I can't stand calling it that. The big bad beautiful bill, and the implications for Medicaid recipients, and to prepare and understand the fallout for things like work requirement, granted advantage patients, all of that. And so it's not necessarily a popular bill, but we think it's a really important bill because the last time there was a change, a lot of people lost their Medicaid. We couldn't get them back on in a hurry. The department was overwhelmed. They didn't have enough people at the DHHS welfare offices to get people back on. And so the uncompensated care issues for providers rose. And so 1754 is an important one to all of us. So is 1794.
And I would argue that that is probably the most critical. We talked about this at a national level a couple of weeks ago, that every state should be doing this, that it's really important.
Well,
Well,
can I
thank you.
see the next page, Scott?
Yeah, sure. I think we'll go to two more of our friends. I think Monica had one and then Jennifer had another.
Okay.
Yeah.
Oh,
So,
and the only, I forgot to mention one more, you guys, that does not align with the health, with our state health improvement plan on the housing side, and that was legislation 1569 The state was gonna sell the Anna Philbrook Center, which would make 16 chronically and severely mentally ill people homeless, potentially. And I guess the state was gonna get $5 million for it. So there's legislation to stop that from happening, so we don't create homelessness amongst the disabled population, and that we're more thoughtful in how we decide to sell a building or not, particularly when it's currently being used in part for housing 16 people.
And I am very proud to say my name's in that bill, and that's a really wonderful bill.
It is a good bill.
It is.
Well, and again, if you look back, Maggie, we've been around a while. Every time we sell one of these buildings, it ends up costing us a lot more money to either lease or buy back, or, I mean, we haven't learned our lesson from the renovation projects that have actually saved us.
And it gets back to what you said.
There's a hospital, it's Steward Health is a case study to how private equity does exactly what you just said, bankrupting hospitals in Massachusetts. Because they separate the building out, they sell it back, basically drain the hospital dry, and then at least one of them is currently living in a non-extraditable country. I'll just leave it at that.
Yeah. So Monica, if you're there, take us through SB 543 a little bit.
Sure, I'll give just like a basic,
No,
so
it's fine.
I'm hearing some feedback, sorry. Can you guys hear me okay?
You're perfect on our end, yeah.
Okay, so hospitals in general, there's a few things that we're focused on throughout the state, and a couple of the things are capacity issues that we're having, as well as barriers to discharge. Those two things go hand in hand. And so when you're talking about health status and outcomes, if patients are sitting in the hospital and they don't need to be there, perhaps they need long-term care instead, that's holding up a bed that could be used for a patient that does need hospital-based services at that moment. Also may not be the most appropriate setting for someone who needs long-term care because they can't get the right types of services in a hospital that they need when they would need long-term care services. So this bill actually puts in a provision that would help to cover the cost of those patients that are waiting for their Medicaid application to go through. They would be able to move to long-term care facility while that's happening, and have the long-term care facility receive payment for that, as opposed to waiting in the hospital and nobody's getting any payment for any of that. So that could move that along and put the patient in the right place for them and open up a bed for patients in the hospital. So that one is one of the ones we're tracking, but the hospital, through the Hospital Association, we're tracking 193 bills, I think, right now. So it was hard to just kind of pick one, but I think when we were talking about health status and outcomes, that was kind of the one that popped to the forefront of my mind. So that's the general, it's passed the Senate so far, but that's the general gist of that one.
Yeah, thanks for reminding me, Monica, too, like, that's, again, been that first initial weaning process of trying to figure out what organizations that you all represent are following. And here's Monica's group that's got 194, and we have a couple hours, over a couple of months. So that was a great reminder.
When you look at this table, maybe a column on the right on aligns is when you look at a particular bill, who's engaged with it?
Yeah.
Is it the Hospital Association, Bi-State Primary Care, Mental Health Association, Healthy Futures? So we they almost become ad hoc members and or recipients of some of these subcommittees. And then they can, when they testify, they can bring the state health improvement. Maybe they're the ones who actually
Hold that thought.
carry it on. And oh, by the way, in addition to our testimony upon review of the state health improvement plan, we're confused because this bill actually is inconsistent with what your constituents said were important.
I think, hold that, because I think that's you're foreshadowing what's a key. Because the question is, all this work then leads to what?
So I wanted to point out on SB,
Yeah,
on SB 543, what's really exciting about that bill, it's almost all Senate folks, but it's bipartisan, which is.
I'll take that off the record. I just hit the recording for a second.
Oh, no, it's bipartisan, and that's like really important.
That is, yeah.
So, and it's passed on a voice vote, which is also exciting, so good job.
And we did add one because as somebody who's grown up with a nurse practitioner as a sister. This is actually a federal big, beautiful bill and something that Jennifer and the Nurse Practitioner Association have been looking at. So I'm going to have her take you through that.
Thank you. And I have to agree with Maggie, big, bad bill.
I was gonna call it the BSB, but we'll leave.
Yeah.
Okay. So for those of you that are not aware, through this bill, it is changing the designation of nurses and nurse practitioners altogether, taking them out of that professional degree status, which is just such a slap in the face across the board to begin with. But more importantly, decreasing the government funding to for student loans. And I cannot tell you how many people I know, nurses that have accessed government student loans and couldn't have gone through their master's or higher levels of education without having access to some money, including myself. I wouldn't be here today without having that support. So this is just substantial in that we already have a workforce that's declining when you're looking at nurses in general, but nurses and nurse practitioners do fill gaps in areas of, geographical location that are hard to fill, and do provide and have, demonstrated statistically that our care does improve outcomes, and that we do provide safe care. So, this bill could really be hurtful to the state. What I'm not sure, which would be very interesting to understand, is the percentage of nurse practitioners that are filling those positions in New Hampshire. I don't know if Bobby's on the line, if she has any insight into that, but just to get an understanding of where we're at in New Hampshire and, those seats that are being filled, that are taking care of our residents.
Board of Nursing should have a sense of how many nurse practitioner licenses and nursing licenses.
Oh, I'm sure they do. I'm sure they do. Well, and that's just licensed. Sometimes it's hard to know if people are retired or not working, or, what capacity they're working, which I know demographically that the board does survey the licensees to get a better understanding of that. But yeah, I think that's about all I have to say.
I just think, Jennifer, it's at a time when we're basically running out of providers. I don't think the timing could be any worse than to say, don't, again, my sister fully capitalized on the federal system to fund her school.
So HR 1 restricts, that's accurate?
Yes.
That's a typo. It does not align.
Oh, I was very confused.
No, that was my typo.
I'm like, actually, it's.
No, it doesn't align at all. No, it's actually.
Okay, go on.
Direct
No,
opposite.
it restricts. Yeah.
Not that they care of what we think, but but it does actually 100%.
This is my total cynicism on all this stuff, but the big BSB created all these problems, and then they decided to hurl this money at rural. Say, well, we screwed you in so many ways, so we're going to give you a little carrot here. And I find that very disturbing, but it is what we got. So I have a comment at the end.
Sure. Well, we'll go through our last one, and then we're kind of open. We got a couple of key questions I think we should look at, but
Yeah, I agree.
more time.
Hey, Scott.
Go ahead. Yeah.
One of the things that I think is important to remember about the dialogue that we just had was that loan reduction amount, part of what was behind it was the assumption that schools were making too much money, and therefore the loans can come down and be restricted because the universities should be charging less. So therefore the implication is that there are implications at the state school level to say the expectations are that there would be less money charged by the universities, which again, that whole systemic effect is not sustainable when we're already fighting to keep monies with our public universities.
Right.
And that is a fallacy of logic called assuming the consequence for anybody who took Aristotelian and Boolean logic, which I would expect no House rep ever has.
I haven't.
I've never heard.
I rest my case.
Yeah.
We can go down the other biases.
So thanks, everybody. Appreciate that. All three ladies, much better job than I've done so far. We're talking about work groups. This is our social connectedness group. We have met once, had a really lovely conversation. Meeting again in a few weeks. You'll see the folks below. I happened to pick out one that was kind of rather, I would say, I don't, egregious is not the right term because we're supposed to be somewhat neutral, but it really goes against everything that is in, it certainly does not align to its point about myself. I'm not aligned at all with anything that's in the SHIP social connectedness domain. And that's 1788, which again requires courts to void all DEI related, contracts and provisions. So I think of our friends Shirley and Ruben and all they've been through with the changes, and it's I don't even know the impact is far beyond what I can guess. There's smarter people on this call, but
I would point out though on this, like we were mischaracterized, right? And so I point both into media coverage as well as the way in which our office and the bill was discussed, which could appear in this as well. I don't know. There are, I think, some varying definitions of what is defined as the DEI.
probably one of the first problems is not understanding what the term means.
Well, that is why we spent, 2 days trying to define equity, which probably was a total waste of time, but it was a value at the same point, because we really needed to define what these words mean. And I guarantee you, they don't even care what the words mean. They just know that it's in there. And I've argued over the last 2 weeks a lot that these are important concepts and that we need, and they're guaranteed by all of our important documents from the Declaration of Independence to whatever, but we don't want to guarantee it because of a disagreement on one particular policy.
I was asked by the House last year to define difference between equity and equality. I'm not sure there was interest in the answer as much.
You were just called to.
They looked at you.
Well, it was during my presentation.
Well, we actually asked the gentleman that wanted to get rid of healthcare equity as a concept, what his understanding of the word equity was. And he never even heard the term healthcare equity. And he was promoting this bill that would have basically cut all the funding for immigrants and people with disabilities and so on and so forth. But the problem is, as you know, it made it through. And that's pretty frightening. Sorry, this is.
Any comments from we've had a great discussion with social connectedness and had no time to actually write up an update. So please feel free for anybody to comment on not only this, but anything else that you talked about, we wanted to talk about. But this was one of those, and I found it interesting. One of those unintended consequences, which comes from a bill like this, is the legal challenges that it invites, and Mississippi found that.
So that's an interesting point. I testified at the Senate on a bill that would have restricted pharmacy benefit managers. And I'm sure it's well documented. And the question that came up, which was not a bad question, was if and when we're sued, where's the money going to come from for the state to fight Big Pharma? So if that is a concern at the Senate, the concern should be independent of what you're being sued for. So there is, if you can't win this on a sense of rationale and linguistics, you may be able to win this on a let it die under the weight of a financial burden that is unknown, and the litigation would be significant and unpredictable.
I think in Mississippi it was ACLU, and then basically every contract holder that.
I mean, I would argue a suit on First Amendment rights and take it to the U.S. Constitution and take it to the Supreme Court on that.
So yeah, I mean, it's one of those that's it's so in your face that it doesn't, I guess, take a lot of.
Who is the Supreme Court justice says I can't define porn, but I know it when I see it? Was that Warren Berger?
No, but I remember.
This starts to live like that. I don't know what it is. I don't like it, and I won't know it until I see it. And I'm like, well, you're a special type of.
So just so I can address what you just said, there were 2 transgender bills last year. One of them was not signed but vetoed by the governor. The other one was signed by the governor. The difference between the two bills was the one of them would lead to lawsuits that we don't have the money to fight.
Yeah.
And that's why she vetoed the bill. It had nothing to do with the policy. The other
I
one,
can live with that.
the issue had already been brought up in other states and the lawsuits had been found in the favor of the government, not the whatever. And that is why that bill was signed. So
Yeah.
they do take into, we do have to take into, whatever, the idea that there's gonna be lawsuits involved and we don't have the money to fight them, so, or we have some.
No, I mean, excellent point. I want to get to, we're doing pretty well. We've had some nice discussion and I worry more about the discussion than I do about the time. We have a few questions that we came up with in the leadership group, but there's one in particular that I want to start with because I don't want to not get to it. And really it's what do we do with the recommendations? So it's like you could say communicate them or whatever, but we've talked in several of the work groups about, do you go to the sponsor? How do you go to the sponsor? Do we work through Dave and Bill, who are current legislators? But I think the first thing, and then Tori has a great idea, I don't want to miss, but the first thing is when you have these recommendations, what is the ship to do with them to get that information?
And I don't know if there's much as recommendations there as observations. And there's a subtle difference that we're the voice of the people whose assessment we heard and crafted a ship. We're the messenger of the people. And the people said this, your bill is in contradiction to it, explain yourself. I'm one who, when I find cognitive dissonance, I prefer to make it as, I'll provide you with a glide path. If you choose not to take it, I will make your decision as painful and public as possible as I can. And then you can stand naked before the people, embarrassed for your lack of gonadal fortitude.
If I can be very cynical in my response to that, we saw how they responded with the Claremont education decisions and just said, this is what the Supreme Court said, and we're just going to ignore you.
Yeah.
And you're right. They should be able to stand by that when it comes election time, but in the short term, it's a difficult strategy. And I really fear sometimes that this is what we, the people, said through the Shaw ship. And they said, fine, we're just going to ignore the Shaw ship and get rid of it.
Well, I think.
And that is a concern of mine.
And that's why I'd say the recommendation gets more dicey because then it starts to lean into partisan.
Right.
That I don't want to go down that.
But I think one of the things that came out of all four work groups was kind of Dave's initial comments going way back almost a year ago, where it was like, we're probably, those people are not convincible, so to speak. It's the middle and all the way to the left. And that's probably who our recommendation citations, et cetera.
Yeah, I wouldn't
You just
go,
need a majority, that's all. You just figure out how you get your majority.
and going to the people who have already made up their mind are not a worthwhile effort. It's the fence sitters that matter.
And I will tell you, on the Republican side, there is a strong group of people, I'm going to say weak, strong group of people, because they have not stood up for what they believe yet, but they need to be able to prove to themselves that they can beat the far right on a consistent basis. And then they will not get the far right to listen to them until they do that. We've now done, I'm not part of them anymore, but like when I was, we were able to win a number of bills. And in this past, yesterday, we won 3 bills that require that group. So that's the group we need to hammer and empower.
So I think, and this is an open discussion, both please put in your chat if you'd rather, but please speak out too. It's really just a chance for the council, all of you, to be able to say, what do we do with this information and how do we present it to who we need to present it to?
Can I make one observation? I find this fascinating because I've been coming to these meetings now, I think, for almost 3 years. And I don't ever remember spending this much time talking about legislation, and I think it's a good thing. But I just wanted to make the observation that this is a bit of a departure from what we've done in the past, and make sure that that's all right with everybody, because obviously it's important to me, but I don't know if it's as important to everybody else.
Well, we kind of started this discussion back a while ago because in the law it says we were supposed to recommend.
Yeah, exactly.
Oh, so if the law says recommend, I feel a little better, although I worry about getting dragged into a partisan.
Well, but I think your point is still very well made. It's really just, and that's what we're trying to talk about is what's the approach?
I do like that if we put it in the hands of the Mental Health Association, and they're gonna go carry water anyways, just like they bring water from the Fiscal Policy Institute, we're another source of, we made observations, and here's some information you could take to the legislator, and if they hear it from the mental health and the hospital and from the public and from my state, you start hearing this from several different directions. It's pretty hard to not take notice.
Polly, I saw your thumb up. I don't want to call you out, but I'm going to call you out. I was just curious what did you like about those comments?
I think I'm agreeing with it being a positive thing to focus on legislation. As we talked in the health, or you talked, I was mostly listening, the health status and outcomes group, that if the statute that created SHASHIP, once we move beyond the assessment phase and create an improvement plan, what's the way to actually implement those strategies that are identified in the improvement plan? It seems to me that going through the legislative process, because that's the way policy changes in the state. So advising the legislature and the governor about our policy recommendations as they are reflected in legislation.
You've got your hand up. Thanks, Polly. That was great.
Yeah, as we talked about this in our work group, the question kind of became, how do we talk about individual bills, and are we playing defense to some degree at that point, or can we or do we go with the concepts of what are the most important components? So we talked during the last few meetings about what would tear away at our foundation, what would be a risk to crumbling other things versus what would be a really fundamental piece of what we need. And then what I think we can agree, there are some things that, again, can we find the money? And those, is that the level that we start to look at things? And that brings us to kind of 2 points. One is what do the legislators need to hear? Do they need the influence on individual bills or guardrails or a lens to view each piece of legislation, so that even if it's not one of the vaccine bills, it can apply to all the vaccine bills? Oh, and then the second thing would be, how do we generate that consensus among the group if we're actually going to make recommendations? So to me, it's what do the legislators need, and then what vehicle do we use to actually get there? And that's an interesting dialogue, because building consensus on a recommendation may take us a little while if it's on individual bills. Anyways.
I say something. Yeah, I really feel strongly that, I'm already, I don't know if I'm running for election again, but if I do, I'm already starting to think about what bills I want to put in for next year. And I think it's important for us as a group to have an influence on that. We think this needs to be done. Find the right guy to write, or woman to write that up, and then go from there. And I think that is the proactive part of it. And I think that that's really important. This is a very slow, I liken this to a slow deliberative body, because we don't meet that often, and to come to consensus is going to be hard. But in these subcommittees, you've already outlined a number of important bills. You've informed 40 people or whatever that these are important things that they can take back to their organizations, that can be much more nimble in affecting legislators directly on as a group, and say, this is our policy or whatever. And I think that serving as an informational thing can affect the retroactive part of it.
So this will be a good time, and Tori, feel free to unmute, and I'm going to try to describe this, but I'll probably fail miserably at it. But the next thing is, after this, the next question folks are going to take on is really looking at the next cycle. So what do you propose? What do you look at for the next cycle? And Tori had the idea, I believe it was with with our health status, but I'm not positive because she's on every group, of what she was calling a health caucus.
Yeah.
So it's basically, the way we had talked about it was, let's say somebody has a housing bill and they're not in the far right, but they're middle to left and they want to run it by. Then we bring in our housing people or access, whatever those folks are. If it's a health status, we bring in our health folks. And then it's basically designed for those folks that are, wise enough when they write bills to look for information before the bills written.
We become the ship Shark Tank.
Exactly.
So, I think a health caucus would be a great idea. It was such a great idea that I actually looked into creating one.
Oh, okay. You and Tori on the same page?
No, it's really important because, we have all sorts of, I hate the word caucus. I'm kind of sick of it, but that is the word we use. And, it seemed like a great idea. And, then we could do exactly everything you just said. And so.
Which I stole from Tori word for word.
Thanks, Tori.
But this is where the problem became, is the minute we create a caucus at the State House, you can't limit your membership. And we knew darn well who was gonna start coming to those meetings. It was the anti-vax
Right.
people were gonna show up. And so the unintended consequence was that, and that's what kind of got us to not do it. But the ideas come up over and over and over again. And I personally think that maybe you should risk that as being a negative outcome, but.
Well, I mean,
think
again,
it's
is there another way? Is it a ship committee and is it?
Yeah.
I mean, again, Tori, I'd like you to chime in here before I
Please.
bury myself.
I really want to hear what you have to say.
Yeah, no, Scott, I think you're capturing everything we talked about. I think that was the goal, was to put it on the table for discussion to see exactly what folks think and what their experience has been. Like David, your observation that there is a risk. And I think what we recognized in looking through the legislation, at least what I think I was seeing, was that there is a lot of legislation that has not been vetted for rationality, logic, and is there a process that we can offer or define that says, if you've got questions about your legislation, we're happy to help put you in touch with folks who can provide more education. And oh, by the way, the state's health improvement plan says this about that issue.
Yeah.
Right.
That would be awesome, because that would be a much better way to do this than
Yeah.
create a caucus in the House or Senate or whatever. And I think that's a much better way, and then offer to all the legislators. A lot of this crazy stuff is coming from, I hate to say, crazy empowered people. And unfortunately, it's the status of what the legislature is right now. We have an opportunity, and I'm not saying that we as a group can do this, but if we change the numbers in the legislature, that will dramatically change the craziness, I think. But they're doing it because they can.
So do you suggest we almost live a little bit like at the federal level, the CBO? That, we can give it a SHIP score. You're presenting legislation. I mean, right now we're looking at it from a retrospective. You've already put your legislation out. And we've got 3 buckets. It's neutral to SHIP, we can't connect the dots. It's contrary to SHIP, or it's consistent with SHIP.
We were using Alliance, does not align, but that's good too.
The line, trying to be descriptive, not
Right.
judgmental
Yeah,
in
right,
the
exactly.
language.
No, it's very.
Then in the future, if you would like to learn more about the SHIP as you work on your legislation, we'll gladly sit and review it with you and first orient you to the SHIP. Do you even know it exists?
As you were talking about that, I was thinking of, and I think it was, forgive me, I think it was the Health Status Group, and somebody came up with the Good Housekeeping seal of approval, kind of that type of thing.
And I think the Fiscal Policy Institute again says, this is what you're presenting. Here's what the financial impact is, and you can decide what you think it means. But we're just going to lay out the facts, and you can decide what you would like to do with it. And this again is it really is. This is This is the people's voice articulated in a plan document about things that'll make Granite Staters healthier in a variety of domains. And your bill is consistent with it. It's independent from it. It's inconsistent.
And I think we had talked in the group about, again, it being ad hoc, so it wasn't a burden for the same folks to attend every time. It's really just the folks that it specifically speaks.
Well, maybe it goes to a subcommittee. If you look at, so the SHIP says, okay, so here's your legislation you're bringing. We suggest you meet with this subgroup because
Maybe
it's
to work
really
with.
about social connectedness.
Yeah.
So it doesn't have to be the commission of a whole.
Right.
Although I think there's some linkage there.
Right.
But really the subgroup needs to think about this because this is the water they swim in. I keep working on my ship metaphor. And I do actually like the Shark Tank. If you'd like us to.
I know, I do. I was kind of thinking that it's a ship tank.
You know, you could walk the plank and we'll tell you if the legislation is going to the sharks or not. Or if it's consistent, we'll welcome you on board the ship.
I was just thinking of something, sorry.
It's fine. I'm done with being a pirate.
No, I like the idea of the caucus not being like a House caucus, but being like a separate thing,
Right.
almost like an advisory board or a congressional
Right.
budget office, whatever. I like that idea. But one thing that may be helpful for us to do that we can do is we can have a session that we advertise at the House, that we invite all the legislators to come and hear what the ship actually does. And then, with the Senate, it's a little easier because you can reach out to their secretaries or whatever they're called. The House, we don't have that, but
It's horrible.
it is kind of stinky, but but at the same point, you let them know this exists, this is what we do, this is how we can help.
Water wouldn't be so bad.
Yeah.
Yeah.
But no,
I'm sorry, I'm laughing at Tori's comment about the ship tank. You'd have to make sure that you alliterate.
oh, you're right,
Oh.
you're right.
Yes.
Otherwise, they put us in the waste management division.
That's pretty funny.
So, yeah. I think that's the thing that the group has to figure out is like, what's the connection? And there was an ask in the health status group again about, do you contact the clerk of the House? Or like, where's that inroad? And that's why we wanted to get your and Bill's input on like, where's the inroad for a
Well, to do what I just suggested, I mean, we just reach out to usually it's the majority leader or the clerk, and we just want to get on, the calendar. We just want to say, we're going to offer this and this
Yeah.
is when it's going to happen. So that I can do the pragmatics of that fairly easy if we want to do that.
Sure.
As far as the other things, there's not a single answer for that question. So it's important to be familiar with committee chairs. It's important to be familiar with the majority and the minority offices. And I think those are your big inroads. The first person I talked to about a bill that I have any interest is the committee chair. You want to talk to the sponsor too. That's important.
But I wondered, let's throw this out because you've all had some great input on, let's call it Health Caucus for now because Ship Tank is out for a second. Do we kind of focus the group's efforts on that, not worrying so much about current legislation? Maybe we pass that through our folks and really focus those energies more on creating this next.
So I think that at a surface level, it wouldn't be difficult to have that initial review of, as I did with AI, it was easier to say, okay, it fits, it doesn't fit, or it doesn't matter.
Right.
And so that's a place to start. And I think as David pointed, if we're going to have a broader conversation with the House and the Senate, there's an educational piece. Let's walk you through the process of how we got to the ship to connect the dots between the people who responded to Shaw questions, who are your constituents. And the ship document is important because we'd like our friends, family, neighbors to be as healthy as possible. I think we can agree on that, I hope. And when you pass legislation, we have an opportunity for you to have your legislation reflected upon the ship, and we could do that on your behalf and give it back to you with an opinion of it's consistent, inconsistent, or it's independent from. We can do follow-up dialogue. I suspect some of you may go to the Fiscal Policy Institute to get a financial score. So this is kind of like you set us up. We're coming back to you, and this is what we can do for you. And you could do a straw count. How many people think that this is something you would enjoy availing yourself of? We can work electronically initially. Based on initial review, we can have a conversation. You can smile, you can frown, you can do with it what you want. Maybe you change some of the language, or you change your budget, or maybe you do nothing.
Just to.
I don't want to interrupt.
Yeah.
I haven't checked in with my folks here on the screen for a while. I don't know if anybody has any thoughts. I'm looking at Maggie just because I'm looking at her. There's no real reason.
I would say I would include the,
Maggie just unmuted. Go ahead, Maggie.
Go ahead.
I just think that, and we talked about it in our work group, obviously, the health caucus idea, and I think that it can only help, right? There's no harm in putting ourselves out there, and being willing, if we've looked at the legislation in any of our groups and done that checklist, does it match the SHAWship? I think we have nothing to lose and everything to gain.
I think it's a great idea.
Yeah, and there was something that just occurred to me when you were saying that. I think the thing is, there is no requirement. It's completely a legislator's choice to utilize us. There's no requirement that you do. But it's just, if you're writing good legislation, as our friend Dave from Nagels Bagels does.
Nice.
Then you check in and try to get it to be the best the first time around you can get.
If I could make a suggestion too, I would not exclude the executive council from this discussion. Because some of the bills we're talking about are big money things, and they need to be educated too.
Again, I think that's, from 1,000 years in public health, and we've gone back and forth about education and its capacity for behavior change. But again, I think all you can offer is good information. We talk about this in all 4 groups about how pummeled with information all these folks are. And again, when we're talking about maybe that further right side about DEI without knowing what DEI is, it's like, again, if we can provide just good, solid information with them to make decisions on this.
Yeah, I just found when people get stuck in that scenario to ask a series of questions in a generality in a case study format without using language as charged. You get a sense of what their true belief systems are without the triggers.
And I think a great example of that, I'm picking on Maggie today because she hasn't been here for a while, so I just really enjoyed it. The bill that she referenced about, again, the transporting people that are having a mental health emergency, they're working with the person that wrote that to try to figure out how to close those.
I think that's great.
Kind of parts. And that's an example of what we're trying to say here is that let's use our, I should say your, because I'm not part of your expertise to help kind of prevent some of those. Because again, Maggie, I think you probably agree that there wasn't anything intentional there. It was just.
No, I think it was meant to be helpful. Absolutely meant to be helpful.
And again, that's, we had this discussion in all 4 work groups and the leadership group. We cannot prevent bad legislation. That will never happen. But if there are people that are trying to write good legislation, then we can help them.
Yeah. And the one that Maggie's working on is really critical. Is through the years working in healthcare. It's not fair to the sheriff who has to transport with no behavioral health understanding. There's something about being in the backseat of a cruiser that is common knowledge. So that's really pejorative. So how do you provide appropriate transportation that's safe for all parties involved? That doesn't feel like the criminal justice system. The only reason my understanding is criminal justice is involved is it's a matter of safety. Yet we don't provide them with the education. If you look at one of the most terrifying calls you will ever get as a police officer, it's domestic violence, of which there's a lot of behavioral health involved. And if you're going to be shot, it might actually be by the person who made the call. Those are terrifying calls, and we don't educate them. The best person I've seen is Paul Smith, who's the police chief in Littleton. If you didn't know better and you saw him in plain clothes, you would think that he's a behavioral health counselor. He gets it. So I hope this law gets cleaned up because it's needed. It's going to be challenging to figure out how to thread the needle for sure. And it's probably going to require some money. It's going to require some education. We send special vehicles to pick up a PICU NICU child that's equipped with the ambulance for PICU NICU stuff.
Right.
We don't send a general ambulance, or it shouldn't be.
Well, I think it would have been nice to have Justin kind of chime in too. I don't think he can make it, but Maggie and Monica and Jennifer were all kind of chiming in too as medical professionals. It's like you also can't have somebody delivered to an emergency room and dropped off without any.
Yeah, good luck.
Yeah, any real, exactly. So I think that's important. So Dave, while we're all here, and Tori, what do you think, since this was really your brainchild, of having that next step be Dave kind of do a little investigating on his behalf, as far as like, this is what we want to do after the legislation?
I think if that's a great idea, relying on Dave's insight for where to go next. And if folks have other thoughts about a parallel discussion that we should be having in the meantime, please share them. All of my children are out of the house, so I've abdicated responsibility for moving anything in as a child forward. So I think that's a great idea.
So
I think I need help balancing what I think we would be great at with what folks would accept from this group. So that's going to be a process. So recommendations for best next steps are great.
I'm glad you brought, so I'm that this to me seems to be the priority to come out of this discussion is how do we create this? And I have a couple thoughts. We have 4 work groups that are going to be meeting soon that can discuss that within themselves. We can create another committee. But my impression, and I want to make sure I got this right, because I think this is the best way to go, is that we function like a congressional budget office as opposed to creating a caucus of legislators.
Right.
And that we then create some sort of educational thing for legislators to say, this is what the SHAWship is, this is what we are offering you, this is what we want to do, this is who we are, that kind of thing. And include the executive counselors, the House, the Senate, their staff. The staff is the most important people, I think, to include. And do that. Does that make sense?
I see some nods, but feel free to drop in the chat or just unmute. Or just a thumbs up. If it makes sense.
I think it's continuous education for the legislature. They're just, so putting that together as who you are, what we can offer, what, and just continually telling them that. I just know, coming from the developmental side, we have to re-educate every year.
You do, because it's a different group every year.
Right.
I think, Andy, you bring up a great point. My first thought to throw out there is that I like Dave's idea of the next meeting for each work group is to try to discuss what we think we can and should provide. I also think, Dave, if you want to write up a little bit about what you just said, we can send it out to the group ahead of time.
Sure.
We may even have you drop in on some work groups.
Well, I actually just emailed you to give the dates.
So yes, Ed's already on a couple too.
I feel terrible because there are a couple of them, and actually I feel better about the outcomes one than I did before, because you didn't talk all about numbers.
No, and again, we only had really great discussion from that group, but we just had the one meeting. So I think that would be our plan, would be, there's some that we need to schedule, but we've got at least 2 coming right up, is to start thinking about what does this look like. Tori's on in every group. So again, she can be there as that person who's really kind of birthed the idea to make sure it kind of fits. But I really do like the idea a lot of actually providing a place where, you choose to come as a legislator. We're not forcing anything on you. And then really just refining what we're providing.
Yeah, they need to know we exist. And I mean, this is an
Actually, goes back,
incredibly,
goes back to, Ed has been saying this since I've been around
Yeah.
for 2 years. How do people know that we actually exist? So-
and the timing, I actually wanted to show this thing out because, the Republican Party, excuse me for dumping on people, but they chose not to listen to me. And the weird thing is now that I'm on the Democratic side, they're actually listening to me, which I don't understand that at all.
Fascinating.
With that said, one of the leaders of the Republican side, there were a couple bills that I finally got the testicular fortitude to stand up against. And he came up to me after and he said, I'm glad you said what you said because we would have passed those bills if you hadn't said it. There's 40 of you or whatever number there is of us.
Pretty close to it, yeah.
Yeah, that are way more knowledgeable about public health than I'll ever be. And like, you know, if they hear from you and they find out before the fact that these are bad ideas or good ideas or whatever, that'll have a lot of power, I think. And
Well, there's something that's always been very fascinating about this group, which is how I kind of ended up helping you all, is because in almost every public health grant that we have, there's something about a group. I mean, how many of you have been invited to the 30,000th group about whatever it may be? This is the only place I have ever seen with this diverse a group of people that all have that health connection. So if they can connect with, 35 different folks that have a lot of different expertise, there's no other place they can do that.
I know this is an amazing group. I really, this has been probably the most fun discussion. Well, the Medicaid discussion was not fun by design, but this is fun.
Maggie, I'm sorry. I have been staring at you and I don't see your hand up. I'm not sure what's going on. Go ahead.
I just put my hand up, but that's because I read Polly's note in the chat box that says,
Right.
some early successes with different legislatures might be good, like them saying, we went to them for advice or what have
Right.
you, right?
Right.
But is there a way to see, and I should probably know this, but I don't, who introduces the most legislation? Who is a primary sponsor? I hope it's not somebody you're gonna say that I don't work well with, but let's just say
I already know it is.
you do, and there
Oh, I
is a
know
report
who-
that tells me that.
It's a free stater that put the most bills in this time.
Damn. Well, I mean, but to
I would
Polly's
look at
point,
quantity, I would look at quality. Does that make sense?
yeah, I just think, if I knew it was, Tim Hartnett's a new rep. I can get along with him. He does have one thing he put in this year that I know of, but I don't want success on a small level because
Yeah,
if
I
he
get
doesn't
it.
have much credibility and it's his first time in there and he's only, done 2 sponsorships, then that's not the guy to go for. But if there's a free stater I should be rubbing elbows with, I guess
You know,
we could
some of them
identify that. No.
May God strike me dead for saying this, but like there's a lot of free staters that are actually not bad people. And, you can work with some of them and some of them are very independent minded and I don't want to brand them with that title. Yeah, there's certain things you really can't discuss, but I have certain people like, that I just know, like, for example, if I have an insurance related bill, the first person I talk to is John Hunt, because if you don't have his support,
You don't.
forget it. It doesn't matter who wrote the bill.
Right.
And so he's an important person to know and talk to, and he's actually fairly reasonable. On the other side of the aisle, Sue Prentice and I are really good friends, but she's a Democrat, and that may, that she's in the minority, so that may be an issue. But, there's other people over there that I talk to fairly regularly that I get along fine with. But it's really the leadership that decides whether a bill is going to make it or not the person that writes the bill.
Tori, if I'm paraphrasing and I get it wrong, let me know. But again, I think some of this is, one of the things we could provide is that kind of a way of how do we measure the impact or success or lack thereof of legislation. And I don't think that's something, I mean, you're a legislator. I don't think that's something you're trying to do the best you can for the largest amount of people. But I'm not so sure the measurement piece ever really comes into it that much.
Not really.
I mean, New Hampshire fiscal policy is great, but I mean, I think.
We brought that up because like we passed a prior authorization reform bill 2 years ago, which was a really big deal to me. And like, you know, we're sitting here now almost 2 years later. Well, what did we actually accomplish? And found out the reason we haven't accomplished anything is the department hasn't written the rules yet. So they're writing the rules now. So we'll see what happens. But you know, you're right. It's like, you know, revisiting legislation a year or 2 or 3 down the road is important because well, what if we didn't, you know, if there was no follow through, you don't accomplish anything. And I think that's important.
And I think that, go ahead, I'm sorry.
Thanks. You know, I'm wondering if we talk about aligns, neutral, or doesn't align. I'm wondering if there's a second tier that you got at a little earlier that would also be kind of that 4 square high reward, low cost,
right,
or high benefit, low cost, low benefit, low cost, high cost.
Yeah,
high reward, you know, a basic course.
Talking about that, yeah. I think that's what,
you know, I wonder if that's how we, you know, it would might help that we could frame that dialogue without getting too gradient, but getting some clarity so that we're not saying, hey, it's a great idea, and they say, hey, everything that costs $21 million you're saying is a great idea. I think recognizing, you know, that if we're not going to recommend, but we're going to say you align, is just we say this with the following caveats, you know.
There are 2 precedents for what you're saying, Dee. One is called it's called a LEAGUE, LEAGUE table. It's often used in public health. It looks at dollar per year of quality life saved, and it might be too nuanced. So vaccines are in the pieces of pennies per year of quality life saved. And back when they did bone marrow transplant, which didn't work, for end-stage breast cancer, it was $500,000 years per quality life saved. And it's not a value judgment, it's a statement of economics. And the other one is the inverse of risk analysis. We do risk analysis, we do how do we score the risk and how do we score the probability, because we can't focus on everything. And we do this internally. We say, okay, so, I mean, earthquake is on there. It's a high risk, low probability. So we think about it a little bit. A snowstorm is a high risk, high probability. So we think about it differently. So I think you're right that when we look at it aligns, and this is a really good investment for your dollar or whatever. This is easy, moderate, or hard to implement. You know, you could think about some of that analysis that isn't too heavy a lift for us, but to your point, it's more than just alignment. It's like, how would you, and the other one I think about sometimes is if where do we start? And in that instance, we've used what's called an interrelatedness diagram that helps us understand if we start here, the dominoes will fall easier and trying to figure out. So for us, pragmatically, we not only provide care for people in the throes of substance use disorder and recovery, we moved upstream into the K through 12 school to do behavioral health, addressing adverse childhood events with the hypothesis that in the adolescent years there'll be less self-harm and less self-medication. So we've gone upstream, and those are pieces of legislation to think about. Has this legislation moved far enough upstream to really get to the housing issue or to the homelessness or to the food security issue? Do we need to go further upstream?
And I think, Dee, it's a great point. I think we can even bring that into work group discussions as far as those kind of quadrant tools. We've seen a lot of them that people are using that talks about how many people do we affect and costs and, you know, negative outcomes. So I think it's perfect. Actually, Tori had even mentioned when she first brought the idea of that first pass of align, unalign, you know, all that technology is good, but it's not enough. So I think that I think we can talk about exactly what you just mentioned. Is there an easy to understand tool that can kind of give people more an idea of like, yeah, we're going to spend a lot here, but we're not going to get much, or we're going to spend a very little and we're going to get a whole lot, or we're going to spend a lot, but we're going to get a whole lot. So it's just, it's those things that people can really understand from a legislative point of view.
The other
And we
period.
can be iterative. We can be iterative and see what works and what doesn't, you know?
Of course. Of
Yeah,
course, yeah.
so I think that's important, because then we're gonna stop and reflect periodically, and I keep thinking about it from a plan, do, study, act cycle. We're gonna go, okay, this is what we did. Where'd we smile, where'd we frown, what do we do more of, less of, and differently?
Right.
The other piece, when I think about the legislation or think about promulgating rules and then projects, I love the Doorways program in concept, okay? And it's a wonderful thing in an urban environment with a high population density and a paid fire department that's open 24/7. It's difficult to replicate the concept in a rural area where there's too few people over 20 miles with a volunteer fire department. You know, so I've taken the time to actually think about how could I replicate it? And once I get some rural health transformation, I can do a pilot project. So some of the legislative impact will have different impact in a rural area versus a urban area, even when the legislation is intended to address transportation or housing. That's great, but we need to test it and go, okay, how does it live in Coos County versus Hillsborough? You know, does it?
Yeah.
It's kind of testing against, you might need a little more or a little less of something in the legislation to provide opportunity that it will work in both urban and rural.
That's Dee's comment about housing and how it, you know, again, housing zoning in Manchester does not work in Littleton.
Right. So, you know, I appreciate Tori putting in the people in Dover, because I want to go meet them and talk to them.
Yeah.
And then try to think about how could I facilitate that happening where I live in Bethlehem? Is it possible? What would it look differently? Who's the private investor? You know, those sorts of things. Does a zoning ordinance, will the town support it? You know, but it's really cool. I love what they did.
Yeah, I know we're getting close. So the only members of the public, I think, are surely still hanging on, and myself. So we do have, I don't have any couple of comments. Go ahead.
But I just wanted to one thing about what Ed was saying. The piece about investing in things in terms based on cost. There are some conditions and treatments that in theory will go down with cost, with additional investment in time, research, et cetera. Someone who's one of their chronic conditions is a rare disease. I only get better medication because pharmaceutical companies found they can make a ton of money off of it. That's not the case for a lot of other areas, and we could talk about how our system works broadly. But until that changes, I think there's also consideration to things that may be newer, and there will be a chicken or egg problem if we're not going after having people use it, then other companies are going to invest in it and it perpetuates.
Yeah.
That's so weird, because we had that discussion yesterday in the cafeteria at the State House. Exactly what you just talked about.
So as far as next steps, I think Dave's going to write up a little bit about what he had talked about from a legislative standpoint. We will plan on having this be at the top of our discussions for, as far as the, we'll call it, for now, we're going to call it a health caucus. We don't know, eventually it'll end up being. And then we'll have those discussions, and we can kind of report back the next meeting as far as what we've come up with. In the meantime, I think we'll try to finish up our kind of chart that we're working on here with legislation. There's some holes in it still because we haven't met many times. Tori's been kind enough to provide a Google Docs site for us to work. So reach out, and if you don't have access to that. But any other comments before we say goodbye to you for a little while?
I have a couple.
Dave has a couple. I'm going to pause to see if
These are pragmatic questions. They're not.
Okay.
They're nothing more than.
Go ahead.
First, pragmatically, the first part of the legislative cycle is almost over, but crossover is happening. So there's still plenty of opportunities to influence bad legislation or good legislation or whatever. We didn't have a quorum for the first time in a long time. It would be helpful if we do get a quorum, because there's certain things that we can do. But the other thing is we did want to have a meeting every year where everybody tried to come.
Right.
And June would be about the
June,
time.
yeah.
So that's probably 2 meetings from now, maybe.
Yes, that would be 2 meetings from now, but it's not too early to think about. So we do want to try to do that, have a big in-person gathering in June, and we'll have to figure that date out.
And I
With
will,
barbecue.
and I will throw
And it's
something out in Ed's, in a number of you people, but the one year we did it in Plymouth, we didn't do it here.
Yeah, I think those are some conversations we certainly probably need to have too. If anybody has any suggestions, yeah, let me know. But I think it was nice to have that one big meeting where we all were mostly face to face. And so I think be thinking about where and when that works. June can be tricky with graduations and vacations and all kinds of things. So we'll probably have to do a separate poll for that June meeting just to make sure we get some.
We used to meet at a place, I swear it's like a wildlife sort of Audubon
Yeah.
refuge like in Bow.
Yeah,
It's even closer than that. It's right up, it's.
Right off the highway.
Yeah, you're right when you get the 89 entrance, you just go a little.
So that
past
was-
it.
So
That was kind of a nice-
suggestions like that, you know.
That was
funnel them to us.
nice.
Spa. I'll bring the cucumbers.
Whitney has a nice backyard. She has a little fire pit. You do that.
So I just
Not
wanted
a wild idea, to be honest. Those can be really fun.
But at any rate, if you have suggestions on where an in-person thing may be that you like, let us know. We do have a little money. We don't have a lot, but we've got some various gift cards we still have that have ship's name on them. So if there was a little cost, we could probably swing it.
As we develop whatever we're gonna interact with the state, the legislature from an educational, I think it's important to capture it in a manner that, because I think the next place you take it to is the counties. And they need to be educated.
Yeah, that's for sure.
And then you're out to the select boards, because I can look at our town and some of our towns and go, you're doing X, Y, or Z. I want to thank you. It's not a bad thing to be gracious about, you may not know it, but you're delivering on the ship. And I want to provide you with the ship. And then
And we talked about public health hours too.
when you think about when people are doing those sorts of things, what can we give them as a token of gratitude that they hang in their town hall or something that, you know, that
Right, yeah.
the Shaw Ship would like to recognize the town of.
That's on our list of things that we need to talk more about, because I believe in it. Whitney's tired of talking about it, but I believe in, I think you need to.
You gotta, I mean, we can't ask people to do something if we don't come back and say thank you.
Yeah.
And thank yous are treat. I mean, they're.
Well, and speaking of that, Ed has been the king of the segue today.
There you go.
And I just want to say thank you to everybody. Again, if you're not on a work group, you want to be on one, let me know. I want to thank the work groups have been amazing to work with. And thank you to our new folks for joining, especially Kelly and Heather on very short notice. But we will be in touch soon. And if you need anything from me, you know where I exist. So thanks and get your shovels out. We'll get ready to go. Thanks, everybody.
Oh, shovel. I was trying to,
I'm so.
I'm sorry. You said shovel. I was thinking of totally something.
Yeah.